Yes, so the question that has been asked in the FMGE January 2024 about this triangular depression. So when I fully extend my thumb, there is a triangular depression that appears on the lateral aspect of the wrist, and this triangular depression is known as anatomical snuff box. So why the name has been given anatomical snuff box? Because the drug abuser person, they use this box for the snuffing purpose. That's why the name has been given anatomical snuff box. So in the exam, they have asked about the tendon of this muscle. So this is a tendon which is making the medial boundary of this anatomical snuff box, and this is a tendon of a muscle of the posterior compartment of the forearm, which is known as the extensor pollicis longus, and this muscle is taking origin from the posterior aspect of the ulna, and all the way it is going here, and it is inserting into the distal phalanx of the thumb, which is making the medial boundary of this box. The lateral boundary is forming by the tendon of a two muscle, one which is known as the extensor pollicis brevis, and this muscle is taking origin from the radius and it is inserting into the base of this phalanx, which is a proximal phalanx. And the third muscle, which is also participating in the formation of the lateral boundary, which is known as the abductor pollicis longus, and this abductor pollicis longus is coming from the posterior aspect of the radius, ulna, and the adjacent interosseous membrane, right? So two tendons are making the lateral boundary, extensor pollicis brevis and abductor pollicis longus, and medial boundary is forming by the extensor pollicis longus, the carpal bone, which is known as the scaphoid. So these three bones are making the base of this anatomical snuff box. The important thing about the content, right? So the main content, that is known as the radial artery. Radial artery, if you put your finger here, you can feel the pulsation of this radial artery, right? So which is the main content lying across the floor of this anatomical snuff box. And as you already know that the brachial artery bifurcate into two parts at the apex of the cubital fossa, one which is going towards the ulnar side, which is known as the ulnar artery, and another which is going towards the radial side, which is known as the radial artery, and radial artery enters into this box and become a important content of the anatomical snuff box, right? There are two more structures that are present within the superficial fascia of this anatomical snuff box. One is the nerve and another is the vein. So vein is the cephalic vein, which is start here, right? Beginning of the cephalic vein. And the next content, which is superficial branch of the radial nerve. So these two structures are present within the superficial fascia of this anatomical snuff box, but the main content is the radial artery. The cephalic vein, clinically we use the cephalic vein to put the intravenous cannula. This is a clinical. And if there is a fracture of the scaphoid bone during maybe the road traffic accident or during any violence, so there will be the diminished pulsation of the radial artery. So this is about the anatomical snuff box, important topic of the upper limb part, and has been asked the questions from this anatomical snuff box in the FMGE exam January 2024. So thank you.